patient enters our office after they've signed in and been greeted by the receptionist, they'll be in the waiting room, and then they'll be called back to the clinical area by the member of the doctor's nursing team. And they're brought into an exam room where the nurse gets some history from them. Hopefully their history has been filled out. Then the doctor has the patient in their consultation room with them to get a more complete history and discuss their specific infertility problem and what could be done about it. The treatment plan is starting to be developed. Women calling in with the first day of their period, so they can come in on somewhere between day 2 and day 4 of their cycle to get some hormonal testing such as an FSH, LH, estradiol level. Sometimes we test testosterone. We like to test thyroid and prolactin levels. All those hormonal levels can be done in our full-service endocrinology laboratory. Then basic ultrasound early in the cycle to assess what we call the antral follicle count, or the baby follicle count in the ovaries. Then to test for tubal factor, you're going to test with a hysterosalpingogram, which is a tubal dye test done with X-ray. And then for sperm, we're going to be looking at a semen analysis, a comprehensive semen analysis, not one that's just done, as is done by most hospitals, which is more or less a sperm count with a general assessment of how many are moving and a general assessment of how they look. We're really looking at what is a sperm count, what percentage of them are moving, and what percentage of them are moving in the fastest way that we think is going to cause fertilization. What are the shapes of the sperm? How many are perfectly formed? So that's what we call strict morphology, and not that many hospital labs, for example, do that. So you really need a comprehensive semen analysis, and we do that here as well in our andrology lab.